Jean Dial has lived alone for the past 20 years. So, in an emergency, he's the one who has to call for help.
I was just here cleaning the fish out, which I do annually for the algae, you know. I come over to here to pick some more parts up to put in, like the plants and that, and I just fell to the ground. I just passed out. I rang me mate because I had the phone because I hadn't opened the shed up, and he brought the ambulance in here and right up to the door, and they took me away from here. The ambulance were great. The people in the hospital were great, but there's no doctors there. They videoed cammed a doctor. The decision was to take me to Dubbo base.
Jean spent 5 days in Dubbo Hospital, over an hour down the road, where he was diagnosed with a heart condition. To continue his care, he was told to see a doctor back in Dunedoo to get a referral for a specialist.
So he goes up to the local hospital. I couldn't get in for a week, and I go up the second time. Oh, you have to come back another week.
The wait time can be up to 6 weeks to see a GP about regular stuff.
Joy Beams is the president of the Dunedoo branch of the Country Women's Association.
At the moment we have 2 part-time doctors. At least one of them has their books closed now because they've got enough patients to keep them busy all the time.
Those 2 GPs cover 4 days a week, with one on call at the local emergency department and adjoining aged care facility. For the CWA, that's not enough for the town's 1,200 residents, who are on average 11 years older than the rest of the nation.
The potential for motor vehicle accidents is quite high, so we really need to have a full-time GP here as well as the 2 part-timers.
How often do people have to drive themselves when they're unwell to major centres over an hour away?
Frequently, and even if they attend the emergency department at the hospital, they will sometimes be asked to drive themselves to Dubbo.
The Western New South Wales Local Health District says patients are never directed to drive themselves to larger hospitals, and the mode of transport is based on medical advice, clinical urgency and patient factors. It says it takes all complaints seriously and investigates them accordingly. But Dunedoo is still facing a common issue in many small regional hospitals.
They've lost a few staff and they're having trouble recruiting nursing staff as well as cleaning staff and ones to work in the kitchen. There's a shortage of staff all the way round.
The LHD says it's in the process of recruiting new staff and increases staffing levels at Dunedoo Hospital when additional patients need care.
Since I've been here, a lot of people have told me horror stories of trying to get help in an emergency. But, as is often the case in small towns, they're reluctant to do it on camera for fear of upsetting their local health services.
They're scared. I think you're bugger, you know. People are losing their lives and can't get appointments, and this is rampant, this town. It's absolutely rampant.